Margaret is 73 years old. Last Tuesday, she spent 4 hours at the hospital for a routine screening test her doctor recommended. The preparation left her exhausted for 2 days. She couldn't eat properly, felt dizzy, and her blood pressure spiked from the stress. 3 weeks later, the test found a small abnormality. Now she's facing another invasive procedure, one that carries serious risks for someone her age. Her daughter asks the specialist, "Is this really necessary? Will it actually help mom live longer or better?" The answer shocked them both. What Margaret didn't know is that certain health screenings, tests that sound important and responsible, can actually do more harm than good. The medical community has been quietly changing recommendations, and many older adults have no idea. Today, we're revealing 5 common health checkups that cardiologists, geriatric specialists, and leading medical organizations now say you should seriously reconsider after 70. Here's what most people don't understand. Medical screening isn't one size fits all. What helps a 45-year-old may harm a 75-year-old. As we age, our bodies handle stress, medications, and medical procedures differently. Recovery takes longer, risks multiply, and sometimes finding a problem creates bigger problems than leaving it alone. The American Geriatric Society and other leading medical organizations have updated their guidelines. But many doctors still order these tests out of habit, and many patients assume more testing equals better care. Let's look at the 5 checkups you need to discuss very carefully with your healthcare provider. Routine cancer, screenings in very frail adults, colonoscopies, mammograms, and PSA tests for prostate cancer are life-saving tools for the right people at the right age. But here's what most older adults aren't told. These screenings look for slow-growing cancers that may take 10 to 15 years to become life-threatening. If you're 75 or older with other significant health conditions, you may not live long enough for that cancer to actually harm you. Meanwhile, the screening itself carries real risks. Colonoscopy preparation can cause severe dehydration and electrolyte imbalances in older adults. The procedure itself carries risks of bleeding or bowel perforation. Mammograms can lead to false positives, unnecessary biopsies, and treatments that cause more suffering than the cancer ever would have. Cardiologists and geriatric specialists now recommend individualized decisions based on overall health, life expectancy, and personal values, not just age and routine schedules. Annual Pap tests after adequate prior screening. For decades, women were told to get Pap smears every year, no exceptions. Current medical guidelines tell a different story. If you're over 65 and have had normal Pap tests for years, continuing cervical cancer screening may cause unnecessary harm. The test can lead to false positives, biopsies, and anxiety, with almost zero chance of catching a dangerous cancer in low-risk women. The American Cancer Society and major gynecological organizations agree. Women over 65 with adequate prior screening and no high-risk factors can safely stop Pap testing. This is where many people get it wrong. They think stopping means giving up on health. Actually, it means avoiding procedures that offer no benefit but carry real risks. Aggressive cardiac stress. Testing without symptoms. Heart health is critical, but routine cardiac stress tests in people over 70 without symptoms can create more problems than they solve. Here's why. These tests sometimes show abnormalities that aren't actually dangerous. But once found, doctors feel pressured to investigate further. That leads to cardiac catheterization, threading tubes through your arteries. For older adults, this invasive procedure carries risks of stroke, kidney damage, bleeding, and vascular complications. And here's the part that surprises people. Many of these abnormalities would never have caused a heart attack or required treatment. Leading cardiologists now say, if you're over 70, feeling fine, and have no chest pain, aggressive cardiac testing may expose you to unnecessary risks. Instead, focus on blood pressure control, cholesterol management, and healthy lifestyle habits. Bone density. Scans beyond certain age thresholds. Osteoporosis screening helps prevent fractures, until it doesn't. After a certain point, continuing bone density scans in very elderly or frail individuals doesn't change treatment decisions. If you're already on osteoporosis medication, or if you're too frail for those medications due to kidney problems or other conditions, repeated scans offer no benefit. What most older adults aren't told is this. The radiation exposure adds up over decades. More importantly, the psychological burden of seeing declining bone density can cause unnecessary worry without improving outcomes. Medical experts suggest discussing with your doctor whether continued scanning actually changes your treatment plan. Routine, annual blood work. Just to check everything. This surprises many people, but ordering extensive blood panels every year in healthy older adults often creates false alarms. Lab values naturally change with age. A slightly abnormal result triggers more testing, specialist referrals, and sometimes medications, when the abnormality was actually normal for that person. Kidney function declines naturally with age. Liver enzymes fluctuate. Thyroid levels shift. Chasing every minor variation can lead to overtreatment, medication side effects, and genuine harm. When older adults undergo unnecessary medical testing, the consequences are real and measurable. Studies show that aggressive screening in frail elderly patients leads to higher rates of hospitalization from procedure complications, medication side effects from treating conditions that would never have caused symptoms, increased anxiety and decreased quality of life, financial burden from cascading tests and treatments, loss of independence during recovery from preventable complications. The goal of healthcare after 70 should be maintaining quality of life, independence, and comfort, not simply finding every possible medical abnormality. So what should you do? First, understand this. Skipping certain screenings doesn't mean ignoring your health. It means making informed, age-appropriate decisions. Before agreeing to any screening test, ask your doctor these questions. How will this test result change my treatment? What are the risks of the test itself at my age? What happens if we don't do this test? Does my overall health and life expectancy make this worthwhile? Focus your energy on what truly matters after 70. Blood pressure control, safe medication management, staying physically active within your abilities, maintaining social connections and mental stimulation, eating nutritious foods, and managing chronic conditions you already have. These proven strategies improve both length and quality of life, without the risks of aggressive, unnecessary screening. Always consult with a healthcare provider who knows your complete medical history before making decisions about stopping or continuing any screening tests. Medical care should help you live better, not create new problems. Knowledge is power, especially when it helps you avoid unnecessary risks. If this video opened your eyes to a different side of senior healthcare, hit that like button. Subscribe for more honest, research-based health information for older adults. And comment below. Have you or a loved one ever had complications from a routine screening? Your experience might help someone else make a better decision. Stay informed, stay healthy, and remember, sometimes the best medical care means knowing when to say no.